The City of Elizabeth in Union County launched an initiative in 2013 to improve the health of its residents. It's called Shaping Elizabeth. In July 2015, the New Jersey Health Initiatives awarded a grant to the coalition under its Building a Culture of Health in New Jersey Communities Moving to Action program. The four-year initiative helps coalitions address the many factors that influence health, including behavior, lifestyle, and socioeconomic factors.
The whole thrust of this initiative is really to get these coalitions to work across sectors, and that's different, right? So we're used to working in our own kind of silo, and we're really trying to get all our coalitions to think about how do we engage more voices in our community, different sectors.
Union County ranks 11th out of 21 in New Jersey's county health rankings, yet the number of people living below the poverty line in Elizabeth, the county seat, is more than 11% higher than the rest of Union County. Nearly 9 out of 10 school kids in Elizabeth qualify for free or reduced cost lunches.
We hope to obviously change the health of the people that live in Elizabeth. I think from this training, we hope to be able to take back the tools to better impact people on a broader scope.
Learning how to change the health of Elizabeth residents hasn't been easy for the Shaping Elizabeth Coalition.
We know that it's one thing to bring together multiple agency representatives that all have a passion to work together to change their community. It's another thing to actually work well together to achieve their goals.
So a lot of the frustration that comes out of coalition work is people trying to put their foot on step 4 and they've just missed 1, 2, and 3.
We know we may have missed some steps along the way that we need to now go back and do. So I think it's deciding, and that's why I asked the question, is this parallel work or can we do one? And that we're going to need to decide, do we move forward on what we're doing or do we go back and try and do some of these steps to make the coalition eventually stronger?
The wheels on the bus go round and round.
A lot of our issues here are kids not being able to go and exercise, recess has been cut, not being, we have a lot of obesity here in our district, but we're trying to see how we can get our children engaged so that they can eat healthy food. So it's all about health.
We kind of are infusing them with the importance of healthy eating and physical activity in everything that we do, and hopefully that will then encompass all of us, but they'll look for healthy food, so the vendors will want to sell more healthy foods.
At a Shaping Elizabeth meeting, participants spent a lot of time clarifying roles, but it was work worth doing.
So the model looks like this, and these are called health factors.
What you've had here today was a lot of passion about how important it is to work together, how they can do much more together than they can separately.
Shaping Elizabeth targets the Bayway, Elizabethport, and Midtown sections. Its goal is to grow its focus beyond the obesity that underlies so many serious illnesses, including heart disease, diabetes, and cancer.
Wartime miso is safe.
One activity is the Muravlog Manor Mobile Market.
Muravlog Manor is a property that has 423 family units. We have almost 1,200 people that live here, so it is a pretty large public housing property. The families are of low income, so it's tough for them to make ends meet.
Renisha Young lives at the manor and volunteers at the market.
My assistance has been cut because of the amount of money that I make, so it makes it harder to buy food.
Another manor resident, Tatiana Lyle, says the market helps her feed her family.
It'll be a little struggle. Paycheck to paycheck, scratching food, trying to get it.
So we purposefully chose the end of the month to bring this to the residents so that we could help them stretch their dollars throughout the entire month.
It's a big help. It helps me save a lot of money for my kids.
Delilah Orocho worries about cooking healthy for her 7-year-old daughter.
Her last blood work, she came out with the high trans fat, so I'm trying to make sure I keep her out of the danger zone.
Michelle Ali is a coalition member and nutritionist at Trinitas Regional Medical Center. She conducts surveys at the market to find out what health screenings residents would like to see next.
We want to teach our community members how to eat better. If we start in the community, that's going to help our residents. and try to prevent some of these chronic illnesses as we go down the road.
The hope is to expand this type of mobile food market to other communities and to expand Shaping Elizabeth's reach to address more of the social factors that influence the health of residents in Elizabeth.
We're actually looking forward to working with some other housing authorities to do the same kind of thing. And so what we're doing is using this pilot as a model and inviting other housing authorities to come in and see how they're putting it together.
Our statement on this and our strategic plan is all about what we can do in communities to help strengthen them, keep people healthy around youth development, healthy living, and social responsibility, so this all falls in line.
The strength of our partnerships with the hospital, with the food bank, will enable us to leverage other resources and bring more programs to the families here. So it is critical to the success for the families that live here, to help us with the economy, to help us fight crime, to help us improve the safety. The overall well-being of the families that live here is extremely important, that all these partners come to the table and help out, and that's what's happening right now with the Shaping Elizabeth initiative.